This is Brian Calle with the Orange County Register, and I'm here with Dr. Sally Pipes, the president of the Pacific Research Institute and the author of the new book, The Truth About Obamacare. Sally, thanks for joining me today.
Well, thank you for having me.
Yeah, you're an expert on healthcare, so that's why we wanted to have you in. This is your third book on healthcare?
Yes, in 2004, I published A Miracle Cure, How to Solve America's Healthcare Crisis and Why Canada Isn't the Answer, with a foreword by Milton Friedman, the late great. In 2008, I published The Top 10 Myths of American Healthcare with a foreword by Steve Forbes, because Milton had passed away. And then Regnery just published last week, The Truth About Obamacare.
Now, is this the most provocative of the three?
I think so, because we actually have healthcare legislation, 2,500 pages, signed into law on March 23rd, and it's going to not meet the goals of the president. We will not have universal coverage for all Americans. The cost curve will not be bending down, and so I want Americans to know. When Nancy Pelosi said, we have to pass this bill to find out what's in it, I said, I've got to write a book about what's in it.
That's great. Now, at the top of the book it says, what they don't want you to know about our new healthcare law. What don't they want you to know about our new healthcare law?
Well, they don't want you to know that it's not going to cost $940 billion over 10 years. It's probably going to cost $2.5 trillion over 10 years. The president said over and over again, there will be no tax increases for the middle class, but we've got a new Medicare tax on unearned income, 3.8% for people earning $200,000 a year and over. So middle class people are going to face tax increases. Tax increases on medical device, pharmaceutical companies, insurance companies will all be passed on to us, the American consumer. And we won't achieve universal coverage. The Congressional Budget Office has said 23 million people will still be uninsured in 2019.
Wow. Now you have a unique perspective because you were born in Canada, now an American citizen, and you saw how the Canadian system deteriorated there, and now we're seeing it in our own country.
Right. We have in Canada, the system is called Medicare, Medicare for all, which is what the late Senator Ted Kennedy wanted for America, and I believe what President Obama really wants. I grew up as under single-payer health care, worked at the Fraser Institute. We published a report starting in the 80s, Waiting Your Turn, a guide to hospital waiting lists in Canada. I think very few people in America, and I want to get this message out, Brian, the average wait in Canada from seeing a primary care doctor to getting treatment by a specialist is 4 months. And 17% of Canadians, 5 million out of 32, are waiting to get a primary care doctor. So we're not going to see, a great influx of primary care doctors in this country. There will be fewer. There will be a shortage, probably of 40,000 docs. Seniors are going to be hurt, and we're all going to be paying more for our health care. But ultimately, I think we'll be moved down that path to a single-payer Medicare for all.
So you're clearly advocating for repealing Obamacare. How likely is that? And then second, let's acknowledge that there are some problems with our healthcare system. What are some of the solutions that you would offer in lieu of Obamacare?
Well, I think the goal for all Americans is affordable, accessible, quality health care. This is not going to achieve that, and so I would like to see repeal and replace. Repeal this legislation, but it can't happen until 2013. The Republicans are going to have to take the presidency and Congress. They're going to have a leader, someone like you, I hope, who can actually, get the cats all, together and really force repeal, and then replace it with healthcare legislation that would empower doctors and patients. Change that tax code so that individuals aren't discriminated against. Let people own their own health care. Allow people to buy insurance across state lines. Like a young person like you, you don't want to buy a plan with 45 mandates, in vitro fertilization, alcohol rehabilitation, at least not yet. So I think, we need to do some of those things. In my book, I have 10 solutions for reforming healthcare, which would lead to affordable, accessible, quality care for all.
That's great. And I think you already touched on this, but I think it's important for our viewers at home. If there were one takeaway from this book, what would you want that takeaway to be?
That your taxes are going to go up, the quality of your care is going to go down, we're going to see higher deficits in the country, and care will be rationed or denied, and the first people to be hurt by this will be our seniors.
That's terrible, but I'm glad you're getting the message out. Thanks so much for joining us.
Thank you, Brian.
This is Brian Calle for the Orange County Register.